the NRC, the Institute for Biodiagnostic, is a key element in bringing together the research designed purely for research purposes and identifying which components of that are commercializable, taking that research and bringing it to the private sector. That bridge to the private sector from our health research is something that we cannot do on our own.
But I would say that probably most people don't necessarily understand the richness of the NRC environment on Ellis and the impact that it has not only on the research of tomorrow, but what we're doing today.
You know, they're providing tools that are making other people look pretty good, you know, because they can use those tools for better outcomes.
Well, the fiber tracks look fantastic. How long did that take? The Institute for Biodiagnostics was formed in 1992. We had 10 employees in 1992. We now have a little over 200. We have about 120 in Winnipeg. The mandate is to discover new methods of non-invasive diagnosis. And the second one is to apply those discoveries to help diversify the economy of Manitoba. The ultimate goal of IBD is to save lives. So it should be non-invasive, accurate, and affordable. It's an instrumental technology for early diagnosis of disease. And the best example of that is MRI, magnetic resonance imaging. We perform clinical research on a variety of diseases. The two really big ones are cancer and cardiac disease. But we also work on a lot on the brain. So the first absolute necessity for us is collaboration with medical doctors.
So we can take them into the operating room, as we have done. We can show them an operation for a tumor on the surface of the brain.
It's a perfect marriage between us and the Health Sciences Centre.
We go back and forth, and there's a strong interchange.
Having the NRC Institute for Biodiagnostic right next door is an incredible advantage to HSC. So that gives us a little bit of an edge sometimes in terms of how we look at our research and how we can develop our research so that it's better for us as well as better for the NRC.
I used to work for NRC, and in the early 90s we developed the technology for the intraoperative MRI.
The way IMRIS started was we were collaborating with a neurosurgeon in Winnipeg who said one day, if only I could do MRI during the surgery.
So I asked him really what he thought he wanted. He told me, and then thanks to NRC and the people at NRC, we could build it.
So we put together a team whose goal was to do that, to learn how to move the magnet without disturbing the picture-taking capability. And that turned into the IMRIS instrument.
And so on the 4th of January 1998, I started work for IMRIS. I was employee number 1.
We were amateurs running a company, so we were about to have to go outside Winnipeg for cash. David Graves went to Calgary one day and saw our instrument. He fell in love with the instrument in Calgary.
I met David Graves on March 31st, 2005, and by May 20th of that same year, he had acquired us and taken over as CEO, which was the best thing that could have happened to us.
So this single idea that started between a scientist and a clinician under the umbrella of the NRC has now blossomed into the delivery of medical services on a global basis.
IMRIS has gone the full gamut from an idea to an application of that idea to a commercially viable product that's being sold all over the world that's built right here in Manitoba. So Manitoba is getting all the benefits from that investment in research that was done right here.
Neurosurgery, the way I do it now, has hardly any relationship to what it looked like when I started as a student or a resident. It's changed completely, and you could not imagine that you someday have imaging that you could do during an operation to see what was happening.
Our idea has always been to bring technology to the patient rather than the patient to the technology.
IMRIS is in the business of developing, designing, and delivering image-guided therapy systems. That's what we do. So when we first incorporated IMRIS, we started with a single patent that we purchased from the NRC. And that patent has now blossomed into 32 new patents in addition to the single one that we started from. It's generated over $200 million in sales of products in less than 5 years. So from an economics point of view, there's been a tremendous success story. We've sold products in India, China, Australia, Europe, the US, Canada, all over the world.
I guess one dreams about these things, but I don't think that I ever thought that by 2010 we'd have 37 sites around the world, because it is truly a global product.
The unit that's going into the Health Sciences Center, into the Clayson Institute, that's going to be a unique operation.
With this system, we can then bring the MRI scan right into the operative theatre and take a living picture to show us exactly what we've done. So if we're doing tumor surgery, the intraoperative MRI might show us that there's a little bit left that we couldn't see for one reason or another. It might be covered with blood clot, or it might be covered by a fold of normal tissue. So that allows us to take out as much tumor the first time round as we can.
Well, we're pretty excited about it. It's about the ability to put tools in the hands of clinicians in order to help people who are here in the province of Manitoba. It brings that value proposition for patients in terms of improvement of patient outcomes, an effective environment for clinicians to practice their craft, and a product that hospitals can sensibly use their scarce capital resources to acquire. That's the package we offer.
Not only the intraoperative MRI for surgical procedures, but it's also available to study patients who are having angiographic work done. So that one of the big advances here in the past 10 years has been the development of endovascular approaches to blood vessel problems in the brain.
And certainly from an economics point of view, our ability to bring potential customers into the city, demonstrate the system in our research and development labs, but then go up the street and let them see the system in a real clinical setting and be able to talk to the clinicians who use it on a day-to-day basis is a powerful commercial device for us.
What makes Dr. West and the neurosurgical team special is his focus on patients, which is our emphasis at the Health Sciences Center.
The quality of the clinicians at Health Sciences is world class.
Dr. West takes technology at the very, very earliest stage of its development and applies it to patient care to try and get the most advantage for the patient out of that technology.
Need another TUI, or two more TUIs. Gotta make sure she's well heparinized here.
As neurosurgeons, we see people that are walking around at home in the morning, looking forward to a regular day at work, and then the next minute they're in the emergency room unconscious with a ruptured aneurysm. So we're often dealing with devastating illnesses.
Okay, the micro, please.
Our surgeons can tell them that we have all of the technologies that we need to do our job. You know, we have everything, and in many ways we have more than most places.
So we're going to be performing similar procedure today that you had on your other aneurysm.
I'm proud of the fact that I can say uniformly that the members of the team do have that commitment to patient care. They're very emphatic that they are interested in the technology, they want it to help their patients, but the most important feature is that they're all dedicated to patient care. When I came back here, my first goal was to recruit a new team of neurosurgeons. Neurosurgery was becoming more complicated and that you really had to have a focus in a subspecialty area. Not that that would be the only field that you would do, but that you develop a special expertise in something like aneurysm surgery or brain tumor surgery.
82.6, what do you got there? Made that a big priority when he came back, that an endovascular program be developed. And with that came a lot of resources and support, and those are things that you look for when you're looking to build a program. And so with those things, it was kind of an easy decision, to come here.
Dr. West and his team brought the Gamma Knife to Winnipeg. Dr. West's introduction of the Gamma Knife in Canada allowed us to realize the benefits from Gamma Knife and expand the application of that technology much broader than the initial application.
Although it's called a Gamma Knife, it doesn't use a knife. The knife is a radiation beam. Where the beams focus, you can provide a very strong radiation dose that will kill a tumor, change the DNA in a tumor. We've treated close to 1,500 patients since 2003 with Gamma Knife.
Our next challenge is to take some of our newer technologies, like the IMRIS, and look at what they were designed to do, but then expand the population base that can benefit from those technologies well beyond what they're initially designed for. And it's teams like the neurosurgery team who will make that possible.
How's it going, Thomas?
It's a continuing circle, because you get great people training and they give you ideas and they question you, and they have that atmosphere of trying to push the envelope, trying to make things better, and it's contagious.
We have no doubt that our relationship between IMRIS and the National Research Council Institute for Biodiagnostic and HSC will continue in the future and provide great dividends to the patients and to the research community.
I think the relationship will just continue to grow.
It's our desire, and I know that it's the desire of the Health Sciences Centre, to work on novel, cutting-edge capabilities with this system, and to be able to interact on a timely basis and an immediate basis between the clinicians here at Health Sciences and the scientists and researchers in our company. It's potentially a very powerful relationship.
The Health Sciences Centre Foundation is a catalyst. They encourage us to be our best in research because they have donors who are interested in providing us resources for our research. It gives us resources to do leading edge research. And they push us to be the best that we can be in research.
The future is your imagination.